Welcome to the Empowered Aging Podcast. I'm your host, Michele Walker. Thanks for joining me. My guest today is Katie Teal. She's a doctor of physical therapy, and she's going to talk to us about how she incorporates Pilates into her therapy practice. Now let's get started. Hello, thank you so much for joining us today.
Thank you for having me.
So, Katie, I would like for you to tell our people about yourself, your business, kind of what's your specialty, that kind of thing.
Okay. So I started TealFit physical therapy and Pilates last year. I was actually pretty pregnant at the time and just thinking I wanted more flexibility, more autonomy. So it's been even different than I could have predicted having a child at home, running your own business. So I'm pretty off the radar, but I specialize in corrective physical therapy and Pilates. What I mean by that is more correcting alignment and then finding activation at the core. And I basically work with people that have some kind of musculoskeletal orthopedic injury, whether it be arthritis, past surgery, um, even like Parkinson's, actually, sometimes with
Mhm.
Pilates. Let's see, thinking of my clientele, it's really just anybody that has any orthopedic injury. But most of my clients have had some kind of trauma like C-section. They have trouble activating their core. They've
Mm.
had like a lumbar surgery. They've had early knee surgery affecting movements throughout their 30s. And now they're seeing me with this, old battered body that they're asking for help with.
Mhm.
But it's fun because I get to tune into those fine details that you can't always get into when you're going to like the hospital practice, because to no fault of their own, they just don't have the time to do all that. I don't have to
Yeah.
worry about being behind my computer for the entire session. I almost think of it like boutique physical therapy. I can do whatever my client wants, whether
Mhm.
that's needling, manual therapy, whatever they really need. We can really spend a lot more time getting to address their issues. And I find it really fun because I get to see faster results. And a lot of
Yes.
those clients turn into more recurring clients that come once, twice a week, or with our schedule differences, maybe we just check in once a week, like what's your schedule next week. So it's pretty flexible. That's the fun in it for me. I get to follow
Mhm.
along with them for a long period of time. And then we
And
can kind of like cycle between Pilates, physical therapy, and my
okay.
Pilates is it's more rehabilitative. So it's with my PT cap on always.
Yes. And are these people referred to you from physicians, or do they just hear about you word of mouth? What?
Right. So a lot of it is word of mouth right now. It could be a friend that heard, oh, I heard that you can help with this, and then they'll come see me. It could be a friend of a friend. Some are past people that I've just taught a class to and they liked my style. So I tend to get word of mouth. Or, in fact, I have a few clients that I know because of working with their spouse or their partner in physical therapy. And then they know what I do. So then they refer their partner to me, like,
Uh-huh.
oh, I know this person can help you. And so that's how I come to find them. And then it just keeps trickling down from there.
And do you have a regular class schedule now of for Pilates?
So I mainly just see private people, so like one-on-one and then maybe two-on-one in my
Okay.
office, and it's pretty much just equipped for that. I do teach a couple classes outside of my office
Mhm.
every week, and that's just more like my fun, get to work with 5 to 7 people at a
Mhm.
time, and
Okay.
then I've had some of those people want to see me privately as well. So
Uh-huh.
for me, that's like a fun, it keeps me on my toes, maintains those skills, it
Mhm.
freshens up my perspective. And then I get to kind of go and be on my own. I don't like to be solo all the time. It's fun to be around other people in the profession as well.
Yeah, I agree. I understand. So, thinking about my audience, mostly people with Parkinson's,
Hmm.
seniors, mostly active seniors at this point. What, how would core work help them? What would they get out of it? How do they know if they even need it?
Right. Well, everybody needs core. It initiates all of our movements. It's our powerhouse. I know that sounds so obvious, but most of us don't really know what
Hmm.
it is. We all heard, oh, you should work your core, but we
Hmm.
don't really know exactly what that means. We don't really know where we should feel it. Sometimes we feel it in our back, and we always think that that's bad. So you need someone who knows what it is. But, if you've had, like with Parkinson's, for instance, or any like neurological disorder that affects your balance, your core is a lot of it's concentrated where your center of gravity is. and that equates to your balance. So that's a huge thing of why it can help your population, because they need better balance,
Yes.
reactive writing corrections, but
Mhm.
they also need flexibility and they need those big movements.
Movements.
And the cool
Yeah.
thing about the reformer, it's the Pilates machine that I have, is
Mhm.
that you can get these really big movements in your hips, in your back, um, in your legs, and that really helps with your reactions as well, your balance, your strength. So
Mhm.
it's also like the timing, flexibility, coordination. A lot of those things I find really help to at least carry over. I've seen some carryover actually with just doing Pilates and not really even focusing on those things as much, just
Mm.
moving. But if we
And how
focus on it, then I
how
see more.
is Pilates different from yoga? I I
Yeah, I do that all the time. And there are some crossovers. You might see like you're on your hands and knees and quadruped doing a cat camel. And oh, that's yoga.
Uh-huh.
I won't try to explain exactly what yoga is because I'm not certified or a yogi. I've done yoga and I like it,
Yeah.
but I kind of feel like that seems to me is more like when I want more flexibility, I go take a yoga class. It's very much like a nice flow and rhythm.
Mhm.
Pilates is very technical. It's like that type A exercise. It's very about the minute little things that create the big differences. Those small little tinkering of the motion at times can make
Mm.
all the difference in what muscles you're using. It's
Mhm.
really easy for our bodies to choose the path of least resistance and work all the muscles that are stronger already, or the patterns that we've already developed. I find that Pilates is like breaking those bad habits and strengthening the things that we should strengthen. So
Okay.
I always think of Pilates as more of like it's more focused in on the core. It's driven from the core,
Mhm.
the scapular stability, and
Mhm.
that's where everything comes from. So you can find these big movements, but they all come from this stable core.
Wow. Yeah. So it sounds like we might see a lot of in like a photograph of Pilates and yoga, it would look the same, but
It
maybe
can, yeah.
in the actual class where you're getting the description of it and the focus of what you're doing is where the difference is.
Yeah, I think it's how it's taught. You could
Mhm.
even teach it similarly, I guess, because the
Yeah.
movements could be similar at times, but it's all in how you cue it. And then yoga and Pilates can seem similar, like in a big class, because you're just kind of telling someone to do something.
Mhm.
But Pilates is meant to be a smaller, like 1-to-1 or like 1-to-5, maybe 10
Okay.
focus. You need to have
Mhm.
it small enough to where you can actually go around and correct the position. And you need to be able to correct the
Ah,
exercise. And the hands on is a huge piece of what really gets the benefit out of it, the results.
okay. So a treatment with Pilates would be more of that hands-on that you're describing, not like a yoga
Yeah.
class where they're just up there demonstrating. You're going to have your hands on them.
Yeah, and I've seen yoga instructors go around and, maybe like pull you further into a position or change you a little bit. But the
Mhm.
classes are usually just so big that you can't really realistically do that. So when
Mhm.
I'm one-on-one, it's constantly if we're doing like footwork, for example, there's a foot bar on the reformer. Your feet can go on it, your hands, you can sit on it, but most of the time your feet go on it. I'm always looking for the alignment of where the feet are in relationship to the pelvis. Are we off center? Is the base of support too wide, too narrow? Are the knees tracking over this second toe or the ankle? Are they under the hip? Is the pelvis being tilted forward or backward? We want that neutral pelvis for core
Mhm.
firing. So it's all about those little tiny
Yes.
things. Where's the breath going? The breath is leading you. We want
Mhm.
to cue the core to initiate the movement as well. So it's very, when you get down to it, it sounds very neurotic almost. It's just like the
Uh,
perfectionist exercise,
yeah,
really.
it does.
It
Wow.
goes well with PT because it's very corrective.
Mhm. Is it, would it be helpful for those seniors who maybe have some issues with bladder control and whatnot? That
Yeah, if I
core?
mean, that's usually related to pelvic floor. So just teaching from Pilates perspective, you might not delve that deeply into it. But if you're
Mhm.
also pairing with physical therapy, if you're getting knowledge with the therapist more in pelvic floor, then are you having urgency or frequency? Is it
Mhm.
because the pelvic floor is tight? Is it also weak? So yeah, those things can
Mhm.
definitely be cued there. You can stretch the pelvic floor, you can strengthen the pelvic floor.
Mhm.
I think that can pair nicely with it as well, depending on what you're I guess, what the underlying cause is.
Hmm. So, if I have a senior who's interested in Pilates, but maybe a little bit nervous or afraid to try it,
Yeah.
what would you say to those people that maybe are a little nervous?
I actually think that it's less scary than going into a gym or jumping into like a Les Mills body pump class where you're lifting weights and you're on the
Hmm.
floor. Pilates started on the floor, but Joseph Pilates himself created it with like springs and different tensions. So now it's this moving carriage that actually can take weight off of your body. We do what's called jumping sometimes on a jump board, and
Uh-huh.
almost everyone starts laughing and smiling throughout it because when's the last time that we all just like jumped up
Yeah,
and down
just
without
jump it down.
gravity?
Uh-huh.
Exactly. But you can change the spring to where you feel like you're moonwalking or your body's lighter, so it's actually
Neat.
almost less scary because we can downgrade your body weight. We can put
Hmm.
supportive straps on your feet. We can put them on your hands. We can kind of like bring the exercise to you instead of forcing
Hmm.
your body to the exercise and make it feel more comfortable. We can kind of grade the level more so that
Mm.
it's like less scary.
Hmm. And definitely with the one-on-one or smaller sizes, they're going to get that attention that they need for
Exactly.
modifications or whatever. So,
Yeah, one of my clients is not necessarily like an orthopedic mess like some people I work
uh-huh.
with, and they'll tell me that themselves. But she just came to me as a friend that wanted to start working out with a solid foundation, didn't know really where to start, didn't want to go into a gym and get hurt, felt very intimidated by going into a gym where she wasn't really sure what a personal trainer would have her do.
Hmm.
So knowing me, she came to me and we've been working together for a while, just kind of teaching her what her body should feel like with exercise. So that's fun.
Hmm. Yeah, I think a lot of that one-on-one and kind of problem solving and stuff is interesting.
Yeah,
So, if
definitely.
someone wanted to seek your services, how would they find you?
So I don't have a website right now, and that's mainly so I have one, it's not live because I'm worried that I'll get too many people asking for my help and I can't help just because I'm still at home a lot with my child. But I do have an email and I have a business number that I always have to pull
So
up because I,
we can put that in the description.
yeah.
So if anyone's
So,
interested, look down below and they'll get that
yeah,
information from you so they can either call you or email you.
exactly.
Um,
Those are my two kind of main ways of contacting me
okay.
right now. You can text or call, and you can email.
Yay. Okay.
Yeah.
So we'll see if we can fill you up to max capacity, which, whatever that may
Yeah.
be, but
Right, right.
sounds like a great service. So anything else that you would like to tell our folks that we haven't covered?
I don't think so. I'm just gonna refresh myself for a second. I think that was pretty much, I think one of the things that makes my business a little bit different, you can find most of what I offer in other places.
Hmm.
If you're wanting dry needling, you can go, and some PTs will offer that, like I do. You
Hmm.
can go to the hospital practice or like a breakthrough physical therapy, or just somewhere that's like a private practice. You
Hmm.
can get treatment, but you have to go through all of the hoops to get to maybe that one thing you want. Whereas I offer things like that almost a la carte, but it's not just, oh, come in, let's just throw some needles in you. We're going to make it more of like a well rounded experience. I
Hmm.
always want to have you move afterward to really set in the new muscle alignment. I think that that's something that I can offer that's more of, it's like I said, boutique earlier. What do
Hmm.
you need? We're going to figure this out. We're going to figure out what your body needs and we're
Yeah.
going to get it done. And so I think that that's kind of fun to wheelhouse that a little bit and put that
Hmm.
cap on of it's not just Pilates in my office. It's just that's what I do a lot of right now.
Yeah.
But I have my separate physical therapy part where it's not all just physical therapy. It's like pieces of it. So that's
Hmm.
kind of fun.
Yeah. It's not cookie cutter. That's the thing. It's
Exactly.
very
It's outside the
personalized.
box.
Hmm.
Yeah.
Very nice.
Yeah. Thank you.
Thank you. Thank you for joining us today, Katie.